Step out of the vehicle now! Officer Brett Coleman's voice cut through the humid Atlanta night like a blade through silk. His hand rested on his weapon, fingers twitching with the kind of nervous energy that turns routine stops into headlines. At 11:47 p.m. on Interstate 285, under the harsh glare of police floodlights, those 4 words would set in motion a chain of events that would test everything both men believed about justice, prejudice, and the thin line between life and death. Dr. Darius Mitchell, 42 years old, didn't move immediately. Not because he was defiant, but because he was calculating. 23 years of living as a black man in America had taught him that sudden movements during police encounters were invitations to tragedy. His hands remained visible on the steering wheel of his black BMW sedan, his voice steady when he finally spoke. "Officer, I'm Dr. Darius Mitchell. I'm a cardiovascular surgeon at Grady Memorial Hospital, and I'm responding to a code blue emergency. I have my medical credentials in my glove compartment, and I need to I said, get out, Coleman interrupted, his tone sharper now, more aggressive. Save the story for someone who cares. Officer Coleman, 34 years old, approached the driver's side window with the swagger of someone who'd made this walk 1,000 times before. His badge caught the light from the overhead floods, and his body camera recorded everything, though he didn't know yet how crucial that footage would become. He'd been a patrol officer for 8 years, working the night shift in DeKalb County, where speeding luxury vehicles often meant drug dealers or stolen cars. In his experience, black men in expensive cars at midnight rarely had legitimate explanations for exceeding the speed limit by 30 miles per hour. Dr. Mitchell had been doing exactly 85 in a 55 zone, weaving between late-night traffic with the precision of someone who'd driven these roads countless times. His hospital pager had gone off 17 minutes earlier with a message that made his blood run cold. Emergency bypass surgery needed. Patient coding. Mitchell requested specifically. ETA? The patient was Jerome Washington, a 28-year-old police officer from the same department that had just pulled him over. Washington had been shot during a domestic violence call gone wrong, the bullet tearing through his chest and lodging dangerously close to his heart. Dr. Mitchell was the only cardiovascular surgeon in the region with the specific expertise needed to save the young officer's life. Every second counted, and now he was trapped on the side of a highway trying to convince a fellow officer that his urgency was medical, not criminal. "License and registration," Coleman demanded, his flashlight beam cutting through the tinted windows. "And keep your hands where I can see them." Dr. Mitchell reached slowly for his wallet, his movements deliberate and visible. "Officer Coleman," he said, reading the nameplate on the uniform, "I understand you're doing your job, but I have a police officer dying on my operating table. If you'll just let me show you my credentials." "How do you know I'm doing my job?" Coleman snapped. "You some kind of expert on police procedure now?" The question hung in the air like smoke. Dr. Mitchell had encountered this tone before, the subtle challenge that turned cooperation into confrontation. He'd heard it in medical conferences when colleagues questioned his diagnoses. He'd felt it in hospital boardrooms when his recommendations were met with skepticism. It was the sound of authority being questioned not by expertise, but by assumption. "I'm not questioning your procedure," Dr. Mitchell replied carefully. "I'm asking for your help. There's a man dying, and I'm the only surgeon who can save him." Coleman examined the license, his eyes flicking between the photo and the face before him. Dr. Darius Mitchell, M.D., licensed to practice medicine in the state of Georgia. The address matched the registration, the photo was clearly the same man, and everything appeared legitimate. But legitimacy and truth were different things in Coleman's experience. "Step out of the vehicle," he repeated, his hand moving closer to his service weapon. "I need to search the car." Dr. Mitchell's heart rate spiked, but his voice remained steady. "Officer, I'm going to comply with your instructions, but I need you to understand that every minute we spend here is a minute that could mean the difference between life and death for your colleague." "My colleague?" Coleman's eyes narrowed. What colleague? Officer Jerome Washington. He was shot earlier tonight during a domestic call. He's in critical condition, and the attending physician specifically requested me because of my experience with cardiac trauma. If you call the hospital— Save it, Coleman interrupted. I've heard every story in the book. Drug dealers, gang members, and even fake doctors trying to avoid arrest. You think putting on a suit and driving a BMW makes you untouchable? The words stung because they revealed the assumption that had been driving this encounter from the beginning. Dr. Mitchell wasn't being stopped for speeding. He was being stopped for speeding while black. His medical degree, his years of service saving lives, his reputation in the medical community, none of it mattered in the harsh light of Coleman's preconceptions. But something in Coleman's radio crackled to life, cutting through the tension like a scalpel through skin. The dispatcher's voice was urgent, professional, tinged with the kind of desperation that transcends departmental boundaries. All units, we have an officer down at Grady Memorial, Officer Jerome Washington, badge number 2847, critical condition. The surgical team is requesting the immediate location of Dr. Darius Mitchell, cardiovascular surgeon. Repeat, we need Dr. Mitchell at Grady Memorial immediately. Officer Washington is coding. The silence that followed was deafening. Coleman's hand moved away from his weapon, his eyes fixing on Dr. Mitchell with a mixture of recognition and something that might have been shame. The radio continued crackling with updates, each transmission more urgent than the last. Dr. Mitchell didn't say, "I told you so." He didn't demand an apology or lecture about racial profiling. Instead, he looked directly at Coleman and said, "Officer, I need to go save your colleague's life. Will you help me get there?" Coleman stepped back from the vehicle, his posture changing from aggressive to uncertain. The traffic stop that had begun with suspicion and hostility was transforming into something neither man had expected. But the real transformation was yet to come. "Follow me," Coleman said finally, his voice hoarse. "I'll give you an escort." Dr. Mitchell nodded, already reaching for his keys. But as he prepared to follow the police cruiser toward the hospital, he had no idea that in less than 2 hours, the roles would be reversed completely. The officer who had just accused him of being a criminal would be lying on his operating table, and Dr. Mitchell would hold his life in his hands. The irony was sharp enough to cut, but the stakes were too high for anyone to appreciate it yet. The convoy raced through Atlanta's late-night streets like a scene from a movie, but there was nothing cinematic about the urgency that drove them. Dr. Mitchell followed Officer Coleman's patrol car, emergency lights painting the asphalt in alternating red and blue, their sirens creating a harmony of desperation that echoed off empty buildings and closed businesses. Coleman's radio crackled constantly with updates from the hospital. "Patient is losing blood pressure rapidly. Surgical team prepped and ready. Where's Dr. Mitchell?" The dispatcher's voice grew more strained with each transmission, and Coleman found himself pressing harder on the accelerator, weaving through the sparse midnight traffic with the kind of reckless precision that comes from knowing lives hang in the balance. Dr. Mitchell stayed close behind, his BMW matching every turn, every lane change, every desperate maneuver as they cut through the city. His hands gripped the steering wheel with the same steady control he brought to his surgeries, but his mind was racing through the procedural checklist he'd need once he reached the operating room. Cardiac trauma, gunshot wound, possible damage to the left ventricle. He'd performed similar operations dozens of times, but never with this kind of personal weight attached. The officer dying on the table was Jerome Washington, someone he'd never met but whose life had suddenly become intertwined with his own in the most complex possible way. 20 minutes ago, Coleman had been ready to arrest him. Now they were racing together to save Coleman's colleague, two men bound by circumstance and the fragile thread of professional duty. But fate wasn't finished with either of them. At the intersection of Ponce de Leon and North Highland, where the traffic light had been malfunctioning for weeks, flashing red in all directions, Coleman slowed just enough to check for cross traffic. The intersection was clear, just 4 empty lanes under the sickly yellow glow of sodium streetlights. He accelerated through, confident in his right-of-way, his mind focused on the hospital just 3 miles ahead. He never saw the pickup truck. The Ford F-150, driven by Marcus Hayes, a 45-year-old construction worker coming off a 12-hour shift, had been fighting fatigue for the last 20 miles. Hayes wasn't drunk, wasn't texting, wasn't doing anything more dangerous than trying to get home to his family after another exhausting day. But exhaustion can be just as deadly as any other impairment, and when his eyelids dropped for just 3 seconds too long, his truck drifted through the flashing red light and into the intersection at exactly the wrong moment. The impact was catastrophic. Coleman's police cruiser took the hit on the passenger side, the force of the collision spinning the vehicle like a child's toy before it slammed into a concrete utility pole. The sound was the sharp crack of metal against immovable stone, followed by the terrible silence that always follows catastrophe. Dr. Mitchell saw it happen in slow motion, the way traumatic events unfold when adrenaline stretches seconds into minutes. He watched Coleman's car disappear behind the pickup truck, saw the shower of glass and twisted metal, felt his own vehicle skidding as he fought to maintain control while slamming on the brakes. His BMW came to rest 20 feet from the wreckage, and for a moment the only sound was the hiss of escaping steam from the pickup's radiator and the distant wail of sirens that had suddenly taken on new meaning. Dr. Mitchell was out of his car before it fully stopped moving, his medical training overriding every other instinct. The scene before him was chaos. The pickup truck steaming and damaged but upright, its driver slumped over the wheel but conscious and moving. Coleman's patrol car was crumpled against the pole, its roof partially caved, emergency lights still flashing in a strobe that turned the intersection into a surreal dance of red and blue shadows. "Officer Coleman!" Dr. Mitchell shouted as he ran toward the wreckage. "Can you hear me?" The response was weak but audible. I'm stuck. Can't move my legs." Dr. Mitchell reached the driver's side window, now spider-webbed with cracks but still intact. Through the damaged glass, he could see Coleman trapped behind the wheel, his face pale, a trickle of blood running from his hairline down his cheek. The officer's eyes were alert, but filled with a mixture of pain and panic that Dr. Mitchell had seen countless times in trauma patients. "Don't try to move," Dr. Mitchell said, his voice shifting into the calm, authoritative tone he used in the operating room. "I'm going to assess your injuries." Coleman's eyes focused on the face outside his window, recognition dawning despite the pain and shock. "The doctor. You're the doctor." "That's right. I'm Dr. Mitchell, and I'm going to take care of you." From the pickup truck, Marcus Hayes was climbing out slowly, shaken but apparently uninjured. "Is he okay?" Hayes called out, his voice thick with the kind of guilt that comes from knowing you've changed someone's life forever, even by accident. "Call 911, Dr. Mitchell ordered without taking his eyes off Coleman. "Tell them we have a police officer with possible spinal injuries and internal trauma, and tell them Dr. Mitchell is on scene providing care." Hayes fumbled for his phone, his hands shaking as he dialed. Dr. Mitchell turned his attention back to Coleman, whose breathing was becoming more labored. Through the cracked window, he could see signs that made his stomach drop. The officer's lips were taking on a bluish tint, and there was a wet quality to his breathing that suggested internal bleeding. "Officer Coleman, I need you to stay with me. What's your first name?" "Brett," Coleman gasped. "Brett Coleman." "Okay, Brett. I'm going to be honest with you. You're injured, but I'm here, and I'm not going anywhere. Can you wiggle your fingers for me?" Coleman's right hand moved slightly, a good sign, but when Dr. Mitchell asked him to move his feet, there was nothing. "I can't feel my legs," Coleman whispered, and Dr. Mitchell heard the terror in his voice, the fear every trauma patient experiences when they realize their body isn't responding the way it should. Dr. Mitchell examined what he could see through the window, his trained eye taking in the angle of Coleman's position, the way his body was compressed against the steering wheel, the growing pallor of his skin. The diagnosis forming in his mind was serious. Possible spinal injury, probable internal bleeding, and given the mechanism of injury and Coleman's symptoms, likely damage to his spleen or liver. "Brett, listen to me carefully. You're going to be okay, but I need to get you out of this car and to a hospital. The same hospital where your colleague Officer Washington is waiting for surgery. Coleman's eyes widened. Washington? Is he? He's alive, but he needs me to save him. Just like you need me to save you. The irony wasn't lost on either of them. An hour ago, Coleman had been ready to arrest Dr. Mitchell, convinced he was a criminal trying to avoid justice. Now Dr. Mitchell was the only thing standing between Coleman and potentially fatal injuries. The traffic stop that had begun with prejudice and hostility had evolved into something neither man could have predicted. More sirens were approaching, growing louder with each second. Dr. Mitchell could hear the distinctive wail of ambulances mixed with the deeper horn of fire trucks. Help was coming, but he knew from experience that the next few minutes would be critical. Coleman was showing signs of shock, his blood pressure likely dropping as internal bleeding continued. "Brett, I need you to stay awake and keep talking to me. Tell me about your family." Coleman's voice was getting weaker. "Wife, Sarah, 2 kids. Tommy's 8, Lisa's 5. "That's good. What does Sarah do?" "Teacher, elementary school. She's going to kill me for this." Dr. Mitchell almost smiled despite the circumstances. "She's going to be grateful you're alive. But I need you to help me help you. The paramedics are almost here, and we're going to get you out of this car and to the hospital." Coleman's eyes were starting to flutter, a sign that his blood pressure was dropping dangerously. Dr. Mitchell made a decision that would complicate everything. He used his elbow to break the driver's side window, clearing away the safety glass so he could reach inside and check Coleman's pulse. "What are you doing?" Coleman mumbled. "My job," Dr. Mitchell replied, his fingers finding the carotid artery in Coleman's neck. The pulse was rapid and weak, confirming his fears about internal bleeding. "Brett, I need you to stay conscious. Keep talking to me." "Doctor," Coleman's voice was barely a whisper now. "I'm sorry. About earlier. I was wrong." Dr. Mitchell continued monitoring his pulse while keeping eye contact. "We'll talk about that later. Right now, focus on staying awake." The first ambulance arrived with a squeal of brakes and the slam of doors opening. 2 paramedics rushed toward the wreckage, their equipment bags bouncing against their legs. Dr. Mitchell recognized them. Atlanta's emergency medical system was tight-knit, and he'd worked with most of the city's paramedics over the years. "Doc Mitchell?" The lead paramedic, a veteran named Rick Stevens, looked surprised to see him at an accident scene. "What's the situation?" "Officer down, possible internal bleeding, probable spinal injury. He's showing signs of shock, pulse is weak and rapid. We need to get him out of here and to Grady immediately." Stevens nodded, immediately understanding the urgency. "What about you? Are you injured?" "I'm fine, but I need to follow this ambulance to the hospital. I've got another emergency surgery waiting, and now I've got 2 patients who need me." As the paramedics worked to stabilize Coleman for extraction from the wreckage, Dr. Mitchell stepped back, his mind racing through the implications of what had just happened. Officer Jerome Washington was still on the operating table, his life hanging by a thread while Dr. Mitchell had been delayed by this accident. Now, Officer Brett Coleman was also fighting for his life, and Dr. Mitchell was the common thread connecting both emergencies. He pulled out his phone and dialed the hospital. "This is Dr. Mitchell. I'm en route with another trauma patient, Officer Coleman. Alert surgery that I'm going to need 2 operating rooms prepared simultaneously. And get Dr. Keandra James to take point on the Washington case until I can get there." The voice on the other end was Dr. Amanda Foster, the hospital administrator. "Darius, where are you? We've been trying to reach you for over an hour. I'll explain when I get there. Just make sure both ORs are ready. I've got 2 police officers who need emergency surgery, and I'm not losing either one of them." As the paramedics loaded Coleman into the ambulance, the injured officer's eyes found Dr. Mitchell's one more time. "Doctor, thank you." Dr. Mitchell leaned closer to the stretcher. "Thank me by staying alive, Brett. I've got work to do." The ambulance doors slammed shut, and Dr. Mitchell ran back to his BMW. As he followed the ambulance toward Grady Memorial, his mind was already compartmentalizing the challenges ahead. 2 complex surgeries, both life-threatening, both involving police officers, and both connected to him by the strangest twist of fate he'd ever experienced. But the strangest part was yet to come. Because when Dr. Mitchell finally arrived at the hospital, he would discover that the night's surprises were far from over. Grady Memorial Hospital's emergency entrance exploded with controlled chaos as the ambulance carrying Officer Coleman screamed into the bay. Dr. Mitchell was right behind, his BMW's hazard lights flashing as he abandoned the car in the emergency lane and ran alongside the gurney being wheeled through the automatic doors. "Trauma Bay 2, shouted the triage nurse, a veteran named Sandra Williams who'd worked with Dr. Mitchell for 12 years. "Dr. James is in OR 3 with Officer Washington. She's asking for you." The hospital's fluorescent lights were harsh after the darkness of the streets, casting everything in the stark white glow that made blood look black and skin appear gray. Dr. Mitchell's surgical scrubs were waiting in the changing room, but first he needed to stabilize Coleman and get him prepped for surgery. "What's his BP?" Dr. Mitchell asked as they transferred Coleman to the examination table. "Dropping fast," replied Stevens, the paramedic who'd ridden in the ambulance. "Started at 110/70, now we're looking at 85/50 and falling." Coleman was semi-conscious, his eyes fluttering open occasionally but his responses sluggish. Dr. Mitchell immediately began his examination, his hands moving with the practiced efficiency of someone who'd performed this routine thousands of times. But this wasn't routine. Nothing about this night was routine. "Internal bleeding, probable splenic rupture," he announced to the trauma team assembling around the table. "Get me 2 units of O-negative stat, and someone call the blood bank. We're going to need more." As the nurses moved with practiced precision around Coleman's table, Dr. Mitchell's mind was divided between the patient in front of him and the patient 3 floors up who was also fighting for his life. Jerome Washington had been shot 4 hours ago, and every minute that passed without surgery decreased his chances of survival. "Dr. Mitchell?" The voice belonged to Captain Shanice Adams, a 20-year veteran of the Atlanta Police Department who commanded the district where both Washington and Coleman worked. She was a tall woman with graying hair pulled back in a tight bun, her uniform crisp despite having been awakened from sleep by the emergency calls. "Captain Adams," Dr. Mitchell acknowledged without looking up from Coleman's monitor. "I assume you're here about your officers." "Both of them," she confirmed. "I need to know their status." Dr. Mitchell continued working as he spoke, inserting an IV line into Coleman's arm while monitoring his vital signs. "Officer Washington has been in surgery for the past hour with Dr. James. The bullet missed his heart by millimeters, but there's significant damage to the surrounding tissue. Officer Coleman has internal bleeding and a possible spinal injury from the car accident. I'm going to need to operate on both of them." Captain Adams absorbed this information with the stoic expression that came from years of delivering bad news to families and receiving it herself. "What are their chances? Both cases are critical, but both are survivable with immediate intervention. The challenge is that I'm the only surgeon in the hospital tonight with the specific expertise needed for Officer Washington's cardiac trauma, and I'm also the most experienced with the type of abdominal surgery Officer Coleman needs." "So you're saying you need to be in 2 places at once?" Dr. Mitchell finally looked up from his patient, meeting the captain's eyes. "That's exactly what I'm saying. Dr. James is excellent, but Washington's case requires someone with specialized experience in cardiac trauma, and Coleman needs surgery within the next 30 minutes, or he's going to bleed out." The weight of the situation settled over the trauma bay like a heavy blanket. Dr. Mitchell was facing every surgeon's nightmare. 2 critical patients, both requiring his expertise, both running out of time. "Doctor," Coleman's voice was weak but audible. What about the other officer?" Dr. Mitchell was surprised Coleman was conscious enough to speak. "Officer Washington is being taken care of. You need to focus on yourself right now." Coleman tried to shake his head, but winced in pain. "No. Listen to me. I know what I did earlier, on the highway. I was wrong." His voice was getting stronger, fueled by something beyond his physical condition. "Washington, he's got 2 kids, little girls. If you can only save one of us, Brett, stop talking like that, Dr. Mitchell interrupted. I'm going to save both of you. But if you can't, Coleman insisted, choose him. He's got more to live for. The trauma bay went quiet except for the beeping of monitors and the whisper of oxygen flowing through Coleman's mask. Captain Adams stepped closer to the table, her eyes fixed on the injured officer. Coleman, that's enough, she said firmly. Dr. Mitchell knows what he's doing. But Dr. Mitchell was staring at Coleman with a mixture of professional concern and personal conflict. The same man who had profiled him, suspected him, and nearly arrested him was now asking him to prioritize another officer's life over his own. It was the kind of moral complexity that medical school never prepared you for. Nobody's making that choice, Dr. Mitchell said finally. I have a plan. He turned to the trauma team. Get Coleman prepped for surgery immediately. Captain Adams, I need you to call Dr. Robert Chen at Emory University Hospital. Tell him I need him here in 20 minutes to assist with a complex abdominal surgery. And get Dr. James on the phone. Dr. Keandra James appeared in the trauma bay before anyone could call her, still wearing surgical scrubs from the ongoing operation upstairs. She was a skilled surgeon in her own right, someone Dr. Mitchell had mentored and trusted with complex cases. Darius, Washington is stable for the moment, but I need you in that OR. The bullet fragments are more complex than we initially thought. Dr. Mitchell looked between Coleman and Dr. James, the weight of 2 lives pressing down on him like a physical force. Keandra, how much time do I have? 20 minutes, maybe 30. But after that, the damage becomes irreversible. And Coleman? 15 minutes, she replied after checking his latest vitals. His blood pressure is dropping too fast. The mathematics of emergency medicine were brutal and unforgiving. 2 patients, 2 different timelines, and not enough time to save both using conventional methods. But Dr. Mitchell hadn't become one of Atlanta's top cardiovascular surgeons by accepting conventional limitations. Here's what we're going to do, he announced to the room. Dr. James, you're going to continue with Washington's surgery. I'll be there in 10 minutes to take over the critical portion. Dr. Chen is on his way to handle Coleman's spleen surgery, but I'm going to start the procedure now to buy us time. Captain Adams frowned. You're going to operate on both of them simultaneously. Not simultaneously, but in sequence with overlapping procedures. It's risky, but it's the only way to save both lives. What Dr. Mitchell didn't say was that this approach violated several hospital protocols and could end his career if anything went wrong. But looking down at Coleman, who was willing to sacrifice his own life for a colleague he'd never met, and thinking about Washington upstairs fighting for survival, Dr. Mitchell realized that some risks were worth taking. Let's move, he said. The next hour would test every skill Dr. Mitchell had developed over his career, every lesson he'd learned about medicine, leadership, and the split-second decisions that separate life from death. But it would also test something deeper. His ability to save the lives of men who represented a system that had failed him repeatedly throughout his own life. As Coleman was wheeled toward the operating room, he grabbed Dr. Mitchell's arm with surprising strength. Doctor, I need to tell you something. Dr. Mitchell leaned closer. What is it, Brett? That stopped tonight. It wasn't random. We've been getting reports about a black BMW speeding through that area for weeks, drug dealers using it as a route. Coleman's eyes were clearer now, the pain medication helping him focus. When I saw you, I thought, I made assumptions. Bad ones. Dr. Mitchell nodded. I know. But that's not an excuse. I've made those assumptions before about other people, other situations, and I was wrong every time. The confession hung in the air as they moved through the hospital corridors. Dr. Mitchell had heard variations of this conversation before, the moment when someone realizes their prejudices have real consequences. But hearing it from a man who might die because of the time those prejudices had cost felt different. Brett, right now I need you to focus on surviving this surgery. We'll talk about everything else later. Coleman nodded weakly. Just save Washington first if you have to choose. As they reached the operating room, Dr. Mitchell made a silent promise to himself. He wouldn't have to choose. Whatever it took, however many protocols he had to bend or break, he was going to save both officers, not because they deserved it or didn't deserve it, but because that's what doctors do. They save lives, regardless of who those lives belong to. The operating room doors swung shut behind them, and Dr. Mitchell began the most challenging night of his medical career. Operating room 3 hummed with the controlled urgency that defines life or death surgery. Dr. Mitchell scrubbed in with the methodical precision that had become second nature over 2 decades of practice, his mind compartmentalizing the emotional weight of the night into the clinical focus required to save lives. Officer Jerome Washington lay unconscious on the table, his chest already opened by Dr. James's initial incision. The bullet had traveled a devastating path through his torso, missing his heart by mere millimeters but tearing through muscle tissue and causing internal bleeding that had nearly killed him twice already. "Talk to me, Keandra," Dr. Mitchell said as he entered the sterile field, his hands immediately moving to assess the damage Dr. James had uncovered. Bullet entered just below the left clavicle, traveled downward and medially. It's lodged against the posterior wall of the left ventricle. The good news is it didn't penetrate the heart muscle. The bad news is that removing it is going to require microsurgery, and the patient has already lost nearly 3 units of blood. Dr. Mitchell studied the monitor displaying Washington's vital signs. Blood pressure was stable but low, and heart rate elevated but steady. The young officer was fighting, but his body was running out of reserves. "How's Coleman?" Dr. James asked, knowing that Dr. Mitchell's attention was divided between patients. "Dr. Chen is prepping him now. Internal bleeding from what looks like a grade 4 splenic rupture. I started the initial assessment, but Chen will have to handle the primary repair." Dr. Mitchell positioned himself at the head of the table, his eyes fixed on the bullet visible on the cardiac monitor. "I'm going to be moving between cases, so I need you to maintain this field until I can extract the bullet." What followed was a delicate dance between 2 operating rooms, with Dr. Mitchell serving as the conductor of an orchestra where every note was a matter of life and death. He would spend 15 minutes working on Washington's cardiac repair, then rush down the hall to check Coleman's abdominal surgery, then return to complete the next phase of Washington's operation. In OR2, Dr. Robert Chen had arrived from Emory and was working on Coleman's damaged spleen. The injury was severe but repairable, requiring the removal of the organ's damaged sections while preserving enough tissue to maintain function. But Coleman's blood pressure remained critically low and his body was showing signs of shock. "How much longer?" Dr. Mitchell asked as he reviewed Coleman's vitals. 20 minutes for the repair, but his pressure is still dropping. We're going to need to transfuse more blood." Dr. Mitchell studied the monitor readings, his mind calculating the intersection of medical need and available resources. "Keep him stable. I'll be back in 15 minutes to check your progress." He returned to OR3, where Dr. James had made additional progress exposing the bullet lodged near Washington's heart. The projectile was a .40 caliber round, its path through Washington's chest a testament to both the violence he'd faced and the millimeters that had saved his life. "Ready for extraction," Dr. James reported. This was the moment that required Dr. Mitchell's specialized expertise. Removing a bullet from cardiac tissue was like defusing a bomb while performing brain surgery. One wrong move could cause catastrophic bleeding or cardiac arrest. His hands moved with the steady precision that had made him one of the region's most sought-after cardiac surgeons. "Forceps," he said quietly, his voice carrying the calm authority that steadied the entire surgical team. The bullet came out cleanly, followed by a brief moment of increased bleeding that Dr. Mitchell controlled with practiced efficiency. "We're good," he announced, and the tension in the room decreased perceptibly. "Close him up, Keandra. I need to check on Coleman." But as Dr. Mitchell moved toward the door, Washington's monitor began alarming. His blood pressure was dropping rapidly, and his heart rhythm showed signs of dangerous irregularity. "He's going into shock," Dr. James called out. "I need you here." Dr. Mitchell was caught between the 2 most difficult words in emergency medicine. "I need." Both patients needed him, Both were critical, and both were running out of time. This was the moment every surgeon dreads, when skill and knowledge aren't enough, when the limitations of being human collide with the infinite need for healing. "Stabilize him," Dr. Mitchell ordered, his hands already working to address Washington's dropping blood pressure. "Push fluids and get me another unit of blood." As the team worked to stabilize Washington, Dr. Mitchell's phone buzzed with a text from Dr. Chen. "Coleman coding, need you now." The words hit him like a physical blow. Two men dying simultaneously, both requiring his presence, both beyond the help of anyone else in the building. This was the nightmare scenario that haunted every specialist, being the only person who could save lives that were slipping away in different rooms. Dr. Mitchell made a decision that violated every protocol in the hospital manual. He was going to coordinate both surgeries simultaneously. "Get me a portable cardiac monitor and a communication headset," he ordered. "We're doing this differently." What happened next would be talked about in medical circles for years afterward. Dr. Mitchell established a direct communication link between both operating rooms, with monitors displaying both patients' vital signs simultaneously. He positioned himself in OR2 with Coleman while maintaining verbal contact with Dr. James in OR3. "Keandra, Washington's pressure is stabilizing, but I need you to monitor his cardiac rhythm closely. Any irregularities, you call out immediately." Dr. Mitchell's hands were now working on Coleman's damaged spleen, the organ torn and bleeding from the impact of the crash. Dr. Chen assisted, but the primary repair required the kind of expertise that comes from years of trauma surgery experience. "Talk to me about Washington," Dr. Mitchell called out as he carefully removed damaged splenic tissue. "Rhythm is steady, pressure holding at 95/60, Dr. James responded through the headset. Coleman's vital signs showed improvement as Dr. Mitchell controlled the internal bleeding, but his blood pressure remained dangerously low. The officer had lost too much blood, and his body was struggling to maintain circulation to vital organs. "Dr. Chen, I need you to take over the splenic repair. Standard protocol. Preserve as much tissue as possible." Dr. Mitchell stepped back from the table. "I'm going back to Washington." But as he moved toward the door, Coleman's eyes fluttered open despite the anesthesia. The injured officer was fighting his way back to consciousness, his body's stress response overriding the medication. "Doctor," Coleman's voice was barely a whisper. Dr. Mitchell leaned closer to the table. "Brett, you need to stay under. We're almost finished." "Washington, is he?" "He's alive. Both of you are going to be fine." Coleman's eyes focused with surprising clarity. I need to tell you something." Dr. Mitchell glanced at the monitors, then back at Coleman. The officer's vitals were stable enough for a brief conversation, but every second away from Washington increased the risk of complications. "What is it, Brett?" "The stop tonight, it wasn't just profiling." Coleman's words came in short bursts between labored breaths. "There's something else, about Washington." Dr. Mitchell's attention sharpened. "What about him?" He was investigating something. That domestic call where he got shot. It wasn't random. He'd been looking into corruption in our district, drug money, evidence tampering. He thought someone in the department was involved. The revelation hit Dr. Mitchell like a physical shock. "Are you saying someone set him up?" Coleman nodded weakly. "He came to me 3 days ago, showed me evidence, bank records, missing drugs from evidence lockup. He was going to file a report with Internal Affairs." Dr. Mitchell's mind raced through the implications. If Washington had been targeted because of his investigation, then his shooting wasn't just a tragic consequence of a domestic violence call. It was attempted murder by someone who wanted to silence him. Who else knew about his investigation? That's what I'm trying to figure out. But doctor, if someone in the department wanted him dead, they're not going to stop just because he survived surgery. The weight of this information settled over Dr. Mitchell like a heavy blanket. He wasn't just trying to save 2 officers' lives, he was potentially saving the life of a whistleblower who had been targeted for exposing corruption. "Brett, I need you to stay quiet about this until we can figure out who to trust. Can you do that?" Coleman nodded. "But doctor, If something happens to me, if I don't make it through this, you're going to make it. But if I don't, you need to know that Washington's evidence is in a safe deposit box at First National Bank on Peachtree. Box 2847, same as his badge number. The key is taped under his desk drawer at the precinct. Dr. Mitchell absorbed this information while monitoring Coleman's vital signs. The officer was growing weaker, his blood pressure dropping again despite the ongoing transfusion. "I need to get back to Washington," Dr. Mitchell said. "Dr. Chen will finish your surgery. But Brett, thank you for telling me this." As Dr. Mitchell rushed back to OR3, his mind was reeling with the complexity of what he'd learned. 2 police officers lay on operating tables, both fighting for their lives, but only one of them knew the real reason why the other had been shot. And now Dr. Mitchell carried that knowledge, along with the responsibility of keeping both men alive long enough to expose the truth. In OR3, Washington's condition had deteriorated. Dr. James looked up as Dr. Mitchell entered, her expression grave. "His pressure started dropping 5 minutes ago. I think there's bleeding we missed." Dr. Mitchell immediately moved to the table, his trained eye scanning the surgical field for signs of internal bleeding. There, a small tear in the cardiac muscle that had been hidden by the initial trauma. It was bleeding slowly but steadily, enough to cause Washington's blood pressure to drop dangerously. "There it is," he said, pointing to the nearly invisible tear. "Probably caused by bullet fragments we didn't see initially." The repair required the most delicate kind of cardiac surgery, working on a beating heart with tissue so thin that a single wrong move could cause fatal bleeding. Dr. Mitchell's hands moved with the precision of a master craftsman, each suture placed with millimeter accuracy. "Talk to me about Coleman," he said as he worked. "Dr. Chen reports successful splenic repair, but his blood pressure is still critically low. He's going to need intensive monitoring for the next 24 hours. Dr. Mitchell nodded, his attention focused on the tiny stitches that would determine whether Washington lived or died. As he worked, he thought about what Coleman had told him about the corruption investigation. If Washington had been targeted, then whoever ordered the hit would likely try again once they learned he'd survived. "Keandra, I need you to do something for me. When we're finished here, I want you to personally oversee Washington's recovery. Don't let anyone except immediate family visit him, and keep his survival status confidential until we know more about his situation." Dr. James looked puzzled but nodded. "Is there something I should know?" "Possibly. I'll explain everything once both patients are stable." The cardiac repair took another 30 minutes, with Dr. Mitchell working in the kind of focused silence that indicated maximum concentration. When he finally stepped back from the table, Washington's vital signs had stabilized, and the dangerous bleeding was controlled. "He's going to make it," Dr. Mitchell announced, and the surgical team collectively exhaled with relief. But as they prepared to close Washington's chest, Dr. Mitchell's phone buzzed with an urgent message from Dr. Chen. "Coleman's pressure dropping again. Think there's additional bleeding. Need you now." Dr. Mitchell looked at Washington's stabilized condition, then at Dr. James. "Can you handle the closure?" "Absolutely. Go save the other one." Dr. Mitchell ran down the hallway to OR2, where he found Dr. Chen working frantically to control what appeared to be new bleeding in Coleman's abdomen. The officer's blood pressure had dropped to dangerous levels, and his heart rate was becoming irregular. "What happened?" "There was additional splenic damage we missed initially. The repair failed, and now he's bleeding internally again." Dr. Mitchell scrubbed back in and immediately assessed the situation. Coleman's spleen was more damaged than they'd initially realized, and the partial repair wasn't holding. There was only one option: complete removal of the organ. "We're going to have to take the whole spleen," Dr. Mitchell announced. "It's the only way to stop the bleeding." The splenectomy was complex and risky, especially with Coleman already weakened by blood loss. But Dr. Mitchell worked with the steady precision that had saved countless lives over his career, carefully removing the damaged organ while preserving the surrounding blood vessels and tissue. As he worked, Coleman stirred again, fighting through the anesthesia with the determination of someone who had something important to communicate. "Doctor." Coleman's voice was weaker now, but still audible. "Brett, you need to stay under. We're almost finished. The corruption, it goes higher than just our district. Washington found connections to the state level, political figures, judges, prosecutors." Dr. Mitchell's hands never stopped working, but his mind was racing with the implications of what Coleman was revealing. "How high?" "He didn't tell me everything, but he mentioned the district attorney's office. Someone there was protecting the drug operation, making sure cases got dismissed or evidence disappeared." This revelation added another layer of complexity to an already dangerous situation. If Washington's investigation had uncovered corruption at the prosecutor level, then the people who wanted him dead had the power to manipulate the entire legal system. "Brett, when this is over, we're going to need to get this information to the right people we can trust." Coleman nodded weakly. Washington trusted someone at the FBI, Agent Lisa Martinez. He was planning to meet with her next week. Dr. Mitchell filed this information away as he completed the splenectomy. Coleman's vital signs began to improve as the internal bleeding stopped, but he was still critically weak from blood loss. "We're done," Dr. Mitchell announced to the surgical team. "Get him to recovery and monitor him closely. I want hourly vital checks and immediate notification if there are any changes." As Coleman was wheeled to recovery, Dr. Mitchell found himself in the unusual position of being not just a surgeon, but a keeper of dangerous secrets. 2 police officers had trusted him with information that could expose a corruption network reaching from street-level drug dealers to the highest levels of law enforcement and the judicial system. But his primary responsibility remained medical, keeping both officers alive long enough to ensure that justice could be served. And that meant protecting them not just from their injuries, but from whoever had tried to kill Washington in the first place. The surgeries were complete, but Dr. Mitchell's night was far from over. The recovery ward at Grady Memorial was quieter than usual at 3:47 a.m., with only the soft beeping of monitors and the whispered conversations of nurses making their rounds. Dr. Mitchell sat in the hallway between the 2 rooms where Officers Washington and Coleman were recovering, his surgical scrub still damp with sweat from the most challenging night of his career. Both men were alive, both were stable. But the information Coleman had shared during surgery weighed on Dr. Mitchell's mind like a physical burden. If Washington had indeed been targeted because of his corruption investigation, then keeping him alive was only the first step in a much larger battle. Dr. James emerged from Washington's room, her expression cautiously optimistic. "He's awake and asking questions. Vital signs are strong, and there's no sign of infection or complications." "What kind of questions?" "He wants to know about the other officer from his department. Apparently word got out that there was a car accident involving a police officer, and he's concerned it might be connected to his shooting." Dr. Mitchell absorbed this information, realizing that Washington's investigative instincts were intact despite his trauma. "What did you tell him?" "That another officer was injured in an unrelated accident and that you performed surgery on both of them. But Darius, he's asking specifically about internal affairs and whether anyone from the department has been here asking about his condition." The question sent a chill down Dr. Mitchell's spine. If corrupt officers were already checking on Washington's status, then the threat to his life was immediate and ongoing. "Has anyone from the department been here?" "That's what's interesting," Dr. James replied. "Captain Adams was here earlier, but she specifically instructed the nursing staff not to provide information about Washington's condition to anyone without her direct authorization. It's like she already suspected something was wrong." Dr. Mitchell stood up, his mind racing with possibilities. Captain Adams had been professional and concerned during their earlier interactions, but in a department where corruption reached unknown levels, trust was a dangerous luxury. "I need to talk to Washington," he said. Officer Jerome Washington was sitting up in his hospital bed when Dr. Mitchell entered, his dark eyes alert despite the pain medication and trauma of the past 12 hours. He was a young man, probably not much older than 28, with the kind of quiet intensity that suggested he took his job seriously. "Dr. Mitchell?" Washington said, his voice stronger than expected. "I heard you saved my life." "You're going to be fine, Officer Washington. The surgery went well and you should make a full recovery." Washington nodded, but his expression remained serious. "Doctor, I need to ask you something, and I need you to be completely honest with me. Was my shooting really just a random domestic violence call gone wrong?" Dr. Mitchell had faced many difficult conversations with patients and their families, but this one carried stakes that extended far beyond the hospital walls. "What makes you think it might not have been?" "Because 3 days before I was shot, I uncovered evidence of a drug money laundering operation involving several officers in my district. I was planning to report it to Internal Affairs, but I wanted to gather more evidence first." Washington's eyes never left Dr. Mitchell's face. "The domestic violence call came in on a radio frequency that's not usually monitored by supervisors. The address was in an area where we'd been tracking unusual drug activity, and the caller hung up before dispatch could get any details." Dr. Mitchell made a decision that would complicate his life but might save Washington's. "Officer Washington, I need to tell you something about Officer Coleman." He related the conversation he'd had with Coleman during surgery, including the details about the safe deposit box and the corruption investigation that reached into the district attorney's office. Washington listened without interruption, his expression growing grimmer with each revelation. "Coleman knew about my investigation? He said you came to him 3 days ago with evidence, bank records, missing drugs from the evidence locker." Washington shook his head. "I never talked to Coleman about my investigation. I didn't trust anyone in the department enough to share that information." The contradiction hit Dr. Mitchell like a physical blow. If Washington had never confided in Coleman, then how did Coleman know the details of the investigation? There were only 2 possibilities. Either Coleman was lying, or he was involved in the corruption himself. "Officer Washington, I need you to think carefully. Is there anyone in your department you absolutely trust?" "Captain Adams," Washington replied without hesitation. "She's been my mentor since I joined the force. She's the one who taught me to follow the evidence wherever it leads, even if it leads to uncomfortable truths about people you work with." Dr. Mitchell felt a measure of relief. If Washington trusted Captain Adams, and if Adams was already taking steps to protect his medical information, then she might be the ally they needed. "There's something else," Washington continued. "The evidence I collected isn't in a safe deposit box. It's in a cloud storage account that only I can access. Coleman either lied to you or someone fed him false information to throw off anyone who might come looking. The pieces of the puzzle were starting to come together, and the picture they formed was more complex and dangerous than Dr. Mitchell had imagined. Coleman knew details about Washington's investigation that Washington had never shared with him, which meant Coleman was either involved in the corruption or had been compromised by someone who was. A soft knock on the door interrupted their conversation. Captain Adams entered, her expression combining relief at seeing Washington awake with concern about the situation they all faced. "Jerome, how are you feeling?" "Better, Captain, but we need to talk about what happened to me and why." Captain Adams glanced at Dr. Mitchell, then back at Washington. "I think I know why. We intercepted radio communications that suggest your shooting wasn't random. Someone in the department leaked information about your investigation." Dr. Mitchell felt the weight of responsibility settling on his shoulders. "Captain, there's something you need to know about Officer Coleman." He explained the conversations he'd had with Coleman during surgery, including the false information about the safe deposit box and the claims about Washington confiding in him. Captain Adams listened with the expression of someone who was putting together pieces of a puzzle she'd been working on for months. "Coleman's been under internal investigation for 6 weeks, she said finally. "We suspected he was taking payments from drug dealers in exchange for information about police operations, but we didn't have enough evidence to make an arrest." Washington tried to sit up straighter in his bed. "So he was feeding information to the people I was investigating?" "It looks that way, and when you got too close to exposing the operation, they decided you had to be eliminated." Dr. Mitchell thought about Coleman lying in the recovery room down the hall, still weak from surgery but alive because of the medical care he'd received. The irony was sharp. He'd saved the life of the man who had helped orchestrate an attempt on Washington's life. "What happens now?" Dr. Mitchell asked. Captain Adams pulled out her phone. "Now we finish what Jerome started. The FBI has been working with us on this investigation for the past month. Agent Martinez is on her way here to take Washington's statement and retrieve his evidence." Washington nodded. "The cloud storage account has everything: bank records, surveillance photos, recorded conversations, enough to expose the entire network." As if summoned by their conversation, Agent Lisa Martinez appeared in the doorway. She was a compact woman in her 40s with graying hair and the kind of professional demeanor that suggested she'd seen her share of police corruption cases. "Officer Washington," she said, showing her credentials. "I'm Agent Martinez, FBI. I understand you have information about corruption in the Atlanta Police Department." What followed was a detailed debriefing that lasted nearly 2 hours. Washington provided access to his cloud storage account, which contained months of evidence documenting a drug money laundering operation that involved not just police officers, but prosecutors, judges, and city officials. The scope of the corruption was breathtaking. Dr. Mitchell listened to the revelations with growing amazement and concern. The traffic stop that had begun with racial profiling had uncovered a criminal conspiracy that reached the highest levels of Atlanta's law enforcement and judicial system. "What about Coleman?" Agent Martinez asked when Washington finished his account. "He's in recovery down the hall," Dr. Mitchell replied. "Still critical but stable. We'll need to question him as soon as he's medically cleared. His cooperation could help us identify other participants in the conspiracy." Captain Adams looked troubled. "Coleman saved Dr. Mitchell's life by providing information about the corruption, even if some of it was false. That suggests he might be willing to cooperate if it means protecting other officers." Agent Martinez nodded. "Corrupt cops who turn state's evidence often receive reduced sentences in exchange for testimony. If Coleman is willing to help us prosecute the higher-level participants, we might be able to work something out." Dr. Mitchell found himself in the unusual position of hoping that a man who had profiled him and helped orchestrate an attempt on Washington's life would recover fully so that justice could be served. The complexities of the situation defied easy moral categorization. "Doctor," Washington said, drawing his attention back to the bed, "I need to thank you for more than just saving my life. By bringing Coleman and me to the same hospital, by treating both of us despite what happened during that traffic stop, you've helped expose a conspiracy that could have continued for years." Dr. Mitchell shook his head. "I just did my job. I treated the patients who needed care." "No," Washington replied firmly. "You did more than that. You showed what it means to put healing above prejudice, medicine above personal grievance. Coleman treated you like a criminal, but when he needed a surgeon, you didn't hesitate to save his life." Agent Martinez looked up from her laptop where she'd been taking notes. "Officer Washington is right, Dr. Mitchell. Your actions tonight may have prevented additional attempts on Officer Washington's life and helped us gather the evidence we need to prosecute this conspiracy." As the sun began to rise over Atlanta, casting long shadows through the hospital windows, Dr. Mitchell reflected on the most extraordinary night of his career. He had begun the evening responding to an emergency surgery call, been profiled and nearly arrested during a traffic stop, witnessed a car accident, performed 2 life-saving operations, and uncovered a criminal conspiracy that reached the highest levels of the city's power structure. But perhaps most importantly, he had demonstrated something that couldn't be taught in medical school or learned from textbooks: that healing requires putting aside personal grievances in service of a higher calling. Coleman had wronged him, had treated him with suspicion and disrespect based solely on the color of his skin. But when Coleman needed a surgeon, Dr. Mitchell had set aside those personal injuries and focused on saving a life. "The interesting thing," Dr. Mitchell said to the room, "is that none of this would have happened if Officer Coleman hadn't pulled me over in the first place. His prejudice created the circumstances that ultimately exposed the corruption he was part of." Captain Adams smiled grimly. "Sometimes justice works in mysterious ways. As Agent Martinez prepared to leave with Washington's evidence and Captain Adams coordinated with hospital security to ensure both officers' safety, Dr. Mitchell made his way back to Coleman's room. The injured officer was awake, his eyes clearer than they'd been during surgery. "Doctor," Coleman said when he saw him, "I heard about Washington. Is he—" "He's alive and recovering. Your information helped us understand what really happened to him." Coleman nodded, then looked away. "I need to tell you the truth about everything, not just the parts that make me look less guilty." Dr. Mitchell pulled up a chair beside the bed. "I'm listening. I've been taking money from drug dealers for 18 months. Not a lot at first, just enough to help with my daughter's medical bills. She has leukemia, and our insurance doesn't cover all the treatments." Coleman's voice was steady but filled with shame. "It started with just looking the other way during traffic stops. Then it became passing along information about police operations." Dr. Mitchell listened without judgment, recognizing the familiar pattern of good people making bad choices for understandable reasons. "When Washington started his investigation, I was ordered to keep tabs on him and report back about what he was learning. I never thought they would try to kill him. I thought they just wanted to know how much he knew so they could cover their tracks." "But you knew they were dangerous people." Coleman nodded. "I knew, but I convinced myself that I was just providing information, not participating in violence. I was wrong." Dr. Mitchell studied Coleman's face, seeing genuine remorse alongside the physical pain. "The FBI agent who interviewed Washington wants to talk to you. Your cooperation could help prosecute the people who ordered Washington's shooting." "I'll tell them everything," Coleman replied without hesitation. "It won't undo what I've done, but maybe it can prevent other officers from getting hurt." As Dr. Mitchell prepared to leave Coleman's room, the injured officer called out to him one more time. "Doctor, why did you save my life? After everything I did to you, after learning that I was part of the conspiracy that nearly got Washington killed, why didn't you just let me die?" Dr. Mitchell paused at the door, considering the question that went to the heart of medical ethics and human morality. "Because that's not who I am," he said finally. "I took an oath to save lives, not to judge who deserves to live and who doesn't. That's what separates medicine from vigilantism." Coleman's eyes filled with tears. "I don't deserve your compassion." "Maybe not," Dr. Mitchell replied. "But that's not my decision to make. My job is to heal. The rest is up to the justice system." As Dr. Mitchell finally left the hospital as the sun rose over Atlanta, he reflected on the lessons of the most extraordinary night of his career. He had learned that prejudice and corruption could be found in unexpected places, but so could redemption and justice. He had seen how a routine traffic stop could uncover a criminal conspiracy, and how the simple act of doing one's job with integrity could change the course of multiple lives. Most importantly, he had demonstrated that true healing requires setting aside personal grievances in service of a higher calling. In saving the lives of both Washington and Coleman, he had not only practiced medicine at its highest level, but had also shown what it means to put principle above prejudice, duty above personal grievance. The story would become legendary in medical circles and law enforcement communities alike, not just as a tale of dramatic surgeries and criminal conspiracies, but as an example of what happens when people choose to do what's right, regardless of personal cost. Dr. Darius Mitchell had begun the night as a surgeon responding to an emergency. He ended it as a man who had helped expose corruption, save lives, and demonstrate that healing, both physical and moral, is possible even in the most difficult circumstances. As he drove home through the morning traffic, Dr. Mitchell realized that the question wasn't whether Coleman or Washington deserved his care, but whether he could live with himself if he had chosen not to provide it. In the end, that choice had made all the difference, not just for his patients, but for a city that would soon begin healing from the cancer of corruption that had spread through its institutions. The traffic stop that began with prejudice had ended with justice, and sometimes that's the best outcome anyone can hope for.